Hello, hello. Welcome to day 4 of zinc deficiency and immunosuppression series. Um, I am your host, Dr. Mihaela Gruita, and I'm the naturopathic pharmacist. And today we will focus our attention on blood pressure medications. And in particular, we are going to address drugs like ACE inhibitors, um, angiotensin receptor blockers, and diuretics. And these drugs, for example, the diuretics are drugs like Lasix or furosemide, also known, drugs like Bumex, spironolactone, um, and also hydrochlorothiazide. There's others as well, but those are much more seldomly used, and sometimes they're used just in hospital settings, not as much at home. Also, the ACE inhibitors are drugs like captopril, enalapril, lisinopril, and drugs like that. And then the angiotensin receptor blockers are drugs like losartan, valsartan, and they are commonly used drugs for hypertension. So all these drugs have been shown in case studies and other post-marketing clinical trials. They have been shown to cause zinc deficiency, and we now know that zinc deficiency has few problems. One, it can be that it decreases the T cell activity, and the T cell is one of the main cells of the immune system. But it also, what it does, at zinc deficiency, it causes an imbalance in two parts of the immune system. One is the Th1 and the other is the Th2. And so when these two are not balanced, you can have an autoimmune disease, you can have inflammation, and even cancer. And also, zinc deficiency can lead to things like dysregulation of P53 gene, which is a tumor suppressing gene. And so when that's dysregulated, you can be in danger of developing cancers. And enough zinc is needed for shorter duration of colds and also for lower intensity of these colds. So, um, so in other words, it's very, very important that we supplement with zinc when we are taking any of this antihypertensive medications. Another issue is that many times people might not be just on one of these drugs, they might be on two drugs. In the name of patient compliance, um, sometimes two of these drugs can be combined in one. So you might have an ACE inhibitor together with a hydrochlorothiazide, or an angiotensin receptor blocker together with an hydrochlorothiazide. And so, for example, um, angiotensin receptor blockers are drugs like Hyzar, or Benicard, Diovan. And usually, the name of these drugs will have an HCT at the end, which basically is the symbol for hydrochlorothiazide, and you know that you have a combination drug. Um, and then here are some names, brand names for ACE inhibitors together with hydrochlorothiazide. You could have Lotensin, that's usually benazepril with hydrochlorothiazide. Monopril is fosinapril together with hydrochlorothiazide. So there's quite a few of these drugs out there, and usually when that happens, now you have two reasons why you might be deficient in zinc. So what's the problem with that? Zinc Deficiency, as I mentioned, it hurts your immune system, as I just described. But in addition to that, it dysregulates two enzymes that are that directly affect your blood pressure. And so, if we continue to be zinc deficient, not only that we might hurt our immune system, but we also might be hurting our blood pressure. So instead of getting better from with the help of those medications, we might actually continue to be to be hypertensive, and you might end up on more than one drug because of that. So zinc deficiency is very, very important to fix. And especially now as the flu season approaches, um, if you are on any of these diuretics that I mentioned, or on any of the antihypertensive medications, the ACE inhibitors or the angiotensin receptor blockers that I mentioned, um, you might want to supplement with zinc to make sure that your immune system has what it needs to fight off those colds, and but also to make your medication more efficient at fixing the blood pressure. So that's what I had for you today. And if you have any questions, as usual, just put them in the questions. I will answer them. And next week, we are also going to address yet another class of medications. They're very, very common, that probably most of us out there are on those drugs. And so stay informed, take good decisions, and also if you want to um, get more chances to ask questions, go to my group called Drug Interactions, and you will be able to ask more questions there, and I will get to them pretty fast. So see you next week. Have a good evening, and I'm looking forward to your questions. So have a good one. Bye.